Hi, it's Dr. Ruth, the Pain Doc, founder and medical director of Chronic Pain Rescue, a soon coming telemedicine practice devoted to helping those suffering from chronic pain to live pain-free or painless, high quality of life. Welcome. Today's post, I have a question for you. How can you exercise when it hurts to move? I'm sure you've asked that yourself if you find that doing exercises, going to physical therapy or whatever has aggravated the pain. So number one, I want to talk about modalities. Modalities are application of things like hot or cold, electrical stimulation. I'm sure there's some others, the hot wave, shortwave diathermy, ultrasound. What is important is if you time those applications of those to your exercise, it'll make the exercising easier. Given an example, you have neck pain and it hurts to move. In fact, you have less range of motion of your neck, but it does feel good or better when you're taking a hot shower. So while you're in the shower, use that time when your muscles are more supple, they feel more pliable, to move your neck. Move it from side to side, move it up and down to the point where you have some pain. If you do that routinely, then you're going to find eventually you can have more and more range of motion to your neck, which is what you want, which is what you need. Another example, say applying a hot pack or a heating pad. You can either time it to do it before you do exercise or after you do exercise. That way, at least the pain won't be so intense. But there's some things you can do at the same time and certainly do that. Another thing is about taking your pain medication. I can remember still a patient that I had many years ago who had a radiating low back pain. I put him on Lyrica and he came back the next month. He said, "Doc, I can't take that medicine. I'm not going to take that." It's like, "Oh, why? It didn't work?" He said, "No, it worked perfectly. I feel no pain whatsoever when I take that medicine, and I'm afraid I'm going to do something that I shouldn't do and hurt myself." So I did find that a bit comical, but there is such a thing as Superman syndrome, where people, because they're feeling better, go out and do some extraordinary thing that sets them back. And certainly I don't want you to do that. But, there are two extremes, it seems to me. There are people who want a pill for every little thing, and they're on 3, 4, 5 different pain meds. They're on something for anxiety and something for the depression. And I'm not saying that you shouldn't get things treated, but usually those people that want to pop a pill for everything and seeking higher and higher doses are the ones we worry about, the ones that get into trouble with getting sick or overdosing and dying. So that's one extreme. But the other extreme are people who don't want to take anything at any time. I don't know why you want to suffer like that. It's not a value or a virtue, all right, to suffer in that kind of way. I don't think that's what saintly suffering is. If you need it, take your pain pills. If you have a 7 or 8 out of 10 level of pain, that's intense pain. Take your pain medicine if it works. And I understand people say, well, they don't want to take it too much because then it may stop working and then you be left with nothing. But you got to find a good balance. And certainly if you're going to physical therapy or you're doing exercises, take your pain medication a half hour to an hour before you do those exercises so that you're able to tolerate the exercises, do them, and you have less pain. Better to do the exercises that are going to help you than to not do them and stay the same or get worse. Third thing, there are lots of types of procedures, lots of injections. And if you haven't had any and you're in terrible pain, you really should check them out with your physician. Say you have a shoulder pain, a knee pain, carpal tunnel syndrome. Steroid injections work very well for a lot of people, and it's worth giving it a try. You cannot do them too frequently. If you do too many of them, they actually cause more problems. They can increase arthritis, weaken tendons and ligaments, and make them risk for further damage or tearing. But 3 a year in a particular joint, spaced out for 3 months at a time, if you need that much, is a good idea. Epidural steroid injections are similar. Those are going into the spine area. They're done under video fluoroscopy, so they're seeing where they're going. It's not done blindly. So people worry about, they might get paralyzed. They might hit a nerve. They really should not do that because they're seeing exactly where they're putting it. They're putting it at the source of your pain, and it's going just outside the spinal cord. Epidural. It's just outside. What that does is decrease inflammation in the area. area. When the inflammation is less, there's less pressure on the nerve. Use that. If you have any pain relief from that at all, use that time to exercise, because it's not going to last forever. For some people, yes, I've heard they got one epidural 6 years ago, they're fine. But if it's effective, you want to use that time to do the exercises that are going to strengthen your muscle, which will help support that area of your body that has pain, so that even if it does wear off, you may not need another one. I wouldn't go for a second one if the first one's still working well. If you're still pain-free or, pain much less, you don't need to necessarily go for that second one, because sometimes it doesn't work. Really, the studies show 50% of them are successful. I think it's worth 50%, half and half. It's worth it if you're in such terrible pain. Anyway, all it is to say, if you're feeling well and you're due for a second one, I would wait, honestly, till you need the second one. Don't get it just because, well, the first one worked really well. Let me see if I can take care of all of my pain, because it may not work that way. That's just the truth. I'm seeing that happen where, the first one was great. The second one, it wasn't good at all. Or the third one wasn't good at all. So only take subsequent ones if it's something that you really need. Use the exercises, the time when you're having less pain, to strengthen your joints, get more flexibility, get more endurance, so that even once that intervention has worn off, you're better off. Okay. There are other types of injections I didn't mention. There's hyaluronic acid injection, a brand name might be Synvis. That's going to put back the normal viscous, thick liquid cushion. If your joints with wear and tear and they become smaller, the bones pushed more together so that joint space is narrowed, it puts back that physiologic liquid cushion there. Also, the hyaluronic acid is a component of your cartilage, which the bones are lined with cartilage normally. When they start eroding, that's when you get all that crunching sound when you're moving that joint that we say, oh, you hear that crunching, cracking sound, that's arthritis. That's because the surfaces are uneven. The cartilage has been worn away. So the hyaluronic acid helps to rebuild that cartilage. So that's effective in more than one way. And you can get those every 6 months if you need that. Another type of injection, PRP, protein-rich plasma injections, where they take your own blood, they spin it down in centrifuge, they get those nascent stem cells, which can, once they're put into that joint space, can be matured into whatever is needed to help grow back. If it's cartilage, if it's bone, ligament, tendon that's been torn, it can help to rebuild those places. So that's another type of injection. There's others. There's nerve blocks and facet joint blocks, and there's a host of things that people can do. Radio frequency, it's kind of a burning the nerve that can help. But all that is to say is that don't stop there. You don't want to just get pain relief. You want to get better. And to get better, you need to get stronger. That body portion that is weak, say you're having low back pain, you need strengthening of your core muscles. So one more thing, just to say, I hope to do one of these sessions on homeopathy, which is another type of medicine, which I've also studied. It's not like traditional medicine at all. In fact, it came from the founder of modern medicine, Dr. Hahnemann, who wasn't happy with the results he was getting with modern medicine. And back in the 1800s, he decided, what else can we do? And he came up with homeopathy, homeo-like pathy disease. So it whole nother approach to medicine, like treats like. I guess you could consider it like how vaccines were. You give a small bit of that pathogen into the system and causes your immune system to react against it, so that when you see that pathogen again, you recognize it, you fight against it, and you don't get sick. Well, similarly, you're giving something that they take and dilute it. They dilute it, put it in your system. You take it in your system, and it helps your body mount a response. So it's really just helping your own recovery, your own self-healing to take place, is how homeopathy works. I find it fascinating. There are hundreds of different homeopathy medications. They're based on symptoms, not on diagnoses. So in the context of pain with movement, I want to share about one that I do have an online store, which you can see on my website, Brionia 9C. That's the strength or the dilution of it. Brionia 9C, 2-3 times a day, taking 5 pellets under the tongue. You let it melt. You don't need to drink anything. You do that for at least 2 weeks, 4 weeks. If you have pain with movement, if you find that you're someone who's always thirsty, you drink copious amounts of water because of that thirst. Pain is worse with moving, maybe worse with heat, except for if it's just a joint. joint and feels better with rest, feels better with applying pressure. Those are some symptoms that would indicate Brionia might work for you. And feel free, you can check it out, buy it on my website, and try for a 2 week or a month and see if that helps you, if those are your symptoms. Anyway, until next time, I certainly invite you to follow us on IG or Facebook, YouTube. Please like our website, check it out, and we'll be up and running in a few weeks. Time always flies, and I hope you'll want to work with me. I'd love to be able to help you, to be a partner with you in coming out of chronic pain and into a high quality of life, one where you can enjoy your family, enjoy working. If you're not able to work right now, getting your life back, that's the key. Until next time, peace and blessings.